Mr. President, I cannot believe that we have come to the floor of the United States Senate at a time of economic hardship and recovery for millions of families, a time where jobs are scarce, the need for a skilled workforce is critical, and student loans are about to double, only to have those on the other side turn this into yet another filibuster, another capitulation to those on the far right of their party. Those who are so far right that when they look back along the political spectrum can see only the small image of their hero Ronald Reagan fading in the distance. They have gone so far to the right that they can no longer see any heroes, not even their own. And so here we are, Mr. President, with our side once again debating the obvious and the other side defending the indefensible position of the far right. We are looking for common sense, reason, and fairness. We are, that is, looking to govern fairly for all. They are looking to play politics that benefit a few. We are asking to stop interest rates on student loans from doubling for 7 million Americans by closing a gaping tax loophole that those who have benefited most from this economy can drive an S corporation through. And my Republican friends on the other side are once again saying no. They are once again attempting to govern from the extreme, once again demanding that even closing an obvious tax loophole that benefits the wealthiest is an unacceptable government intrusion, but that ending preventative care for those who are struggling with rising health costs is the best option. Can they be serious? Can we be standing in this chamber saying that the most reasonable option to prevent student loans from doubling is not common sense tax reform, but ending breast cancer screening for millions of women? Is that the view from the far right of the political spectrum? And I ask my colleagues on the other side, do you really believe that that's a fair option? Have we run through all possible options to have reached a point where we can now say that the only arrow left in the quiver is to end preventative care as we know it? Have we already ended all outrageous tax loopholes for the wealthy? Have we already ended subsidies to big oil that'll make $1 trillion over the next 10 years, and yet we give them $24 billion of tax cuts? Have we ended the Bush tax cuts for the top 1%, and now have no other option than to end preventative health care for women and for millions of Americans whose health depends on it? Now, unfortunately, it seems that our Republican friends have once again put partisanship and politics first. Their budget prioritized tax breaks for the wealthy over keeping college costs down for middle-class families. And only when they realized that this wouldn't play well politically did they reverse course and drop their objections to keeping student loan rates lower, because they said, no, that's not the government's role. But then they said, well, okay, we'll climb on board with that idea, but only under certain conditions. Rather than close a special interest loophole that only a small minority of wealthy businesses can exploit, they would rather cut funding for children's vaccines, mammograms, and other critical services. This is the classic case of giving with one hand and taking with another, and all without asking the wealthiest Americans, those who have reaped the most rewards and benefited the most, particularly in tax breaks that they've received over the last almost decade, to help the country, simply to help the country at this critical time. Mr. President, if that doesn't tell you about the priorities of each party, I don't know what will. These preventative health services not only improve people's health and their lives, they also reduce the cost of health care. That's because it's a lot easier and less costly to treat illnesses when they are first detected. When women have access to affordable mammograms, their doctors will be far more likely to catch breast cancer in its early stages, when it is most treatable and least expensive to cure. When we give a child a simple, inexpensive measles vaccine, we don't have to worry about expensive treatment for measles later on. When we help people quit smoking, we dramatically reduce the cost of treating that individual for a whole host of illnesses. The saying, an ounce of prevention is worth a pound of cure, could not be more appropriate to this debate. For a party that loves to preach about fiscal responsibility, it boggles my mind that they would fight to cut preventative care that will reduce health care costs but allow tax loopholes to stay open. Republicans decided to make a target of these programs not because of substantive issues, I would respect that, but just because, plain and simple, they were included in the president's health care bill. And as we know, as the distinguished minority leader said, it's all about defeating the president. The problem with that is it's not about the president failing, it's about the nation failing at one of its most critical times in its history. Now, they lost the health care debate in 2010, and they have spent every day since trying to refight that battle. Now, Republicans will try to scare people into thinking that closing this corporate tax loophole will kill small businesses. That's the mantra we hear every time. But actually, according to Citizens for Tax Justice, they say, quote, closing this loophole will actually help most small businesses, which are currently subsidizing the minority who abuse it and avoid paying payroll taxes. Isn't that interesting? So most small businesses, they're out there meeting the economic challenge every day. They pay payroll taxes, but those who are taking advantage of this loophole do not. Seems to me we'd be giving small businesses a far better competitive advantage. Let's be clear. The vast majority of small businesses pay their fair share into Medicare. But this loophole, affectionately dubbed the Edwards-Gingrich loophole, has allowed certain professionals like former Senator John Edwards and former Speaker Newt Gingrich to avoid paying millions of dollars into the Medicare program. Technically, they weren't wrong to take advantage of this loophole. We were wrong to allow it to even be available. But enough about the details on how we pay for it. This debate is really about people, all about families struggling to pay for college. As the first person in my family to go to college, who had to rely on federal grants and loans to pay tuition, I have a firsthand appreciation of the importance of giving all students the opportunity to pursue their dreams. For students struggling to pay for college and racking up debt, this is not an academic argument. The extra $1,000 they'd have to pay each year is not theoretical money. It is the difference between being able to repay their loans and entering the workforce with good credit versus being overwhelmed by debt and going into default. Recently, I had the pleasure of having a roundtable and speaking to students from Montclair State University in my home state of New Jersey about how the interest rate would affect them. I heard from Emily Delgado, a first-generation American and the first person from her family to also go to college. She just completed her freshman year at Montclair. And despite working for the college as a student mentor, Emily will still be saddled with approximately $20,000 in debt by the time she graduates. And if she decides to go on to graduate school after that, then of course that will rise significantly. She told me she can't even bring herself to calculate how much the interest rate hike will cost her because, in her words, quote, it will just crush my dreams. Nick Weber works 3, not 1, not 2, but 3 part-time jobs to help pay for college. And despite these 3 jobs, Nick only makes around $175 per week, which is about how much extra he'd have to pay in interest every month if we don't act now. He doesn't think that's fair, and neither do I. A student by the name of Jamie Summer, who dreams of one day becoming a professor, works part-time for the school, but her income hardly puts a dent in her debt, and she fears she won't be able to afford graduate school, won't ever realize her dream. Emily and Nick and Jamie And all the other students who are struggling to pay for college deserve to be able to realize their hopes and dreams and aspirations. And it falls to us, all of us in this chamber, to do all we can to keep those dreams alive. These students deserve our support. They deserve the common sense of a community that understands that we have to reduce the deficit, but that we cannot balance the budget on the backs of the next generation. We cannot cash in their dreams and let those with the most cash out. We need a fair solution, not political dogma. These students have worked hard. They deserve better. They're not asking for a handout. They studied hard in high school, got good grades, took out loans, and got jobs to pay for college. They're working towards a better life, doing what every parent dreams of their children, to do well, build a decent life for themselves and their family, and give something back to their community and to the economy. They epitomize everything we want our young people to be. And all they're asking in return is fairness, not a political sleight of hand that helps them with their student loans, but in the process takes away their health care. All they're asking is for us to not make it harder for them, for us to not add yet another stressor to their lives. And certainly it is our obligation to not shut down their dreams of a higher education, for it is in their dreams for a better life that the economic future of this nation will be built. We are globally challenged for the creation of a product or the delivery of a service in terms of human capital. The boundaries of mankind have largely been erased in the pursuit of human capital. So an engineer's report is done in India and sent back to for a fraction of the cost of the United States. A radiologist's report is done in Northern Ireland and read by your doctor at your local hospital. Or if you have your problem with your credit card, as I recently did, you end up with a call center in South Africa. In the pursuit of human capital for the delivery of service, we are globally challenged. For the nation to continue to be a global economic leader, it needs to be at the apex of the curve of intellect, the most highly educated generation of Americans the nation has ever had. Well, we cannot achieve that if we have students who have to forego not only their dreams, but the ability to help the nation compete globally by getting a world-class education. We owe them every chance to achieve their dreams and to help us make this another American century. Isn't that the least that we can do? And isn't the choice really clear? Let's choose closing a tax loophole that is actually creating challenges to small businesses who are paying their payroll taxes. And let's preserve the preventative health care that will improve the quality of lives of our fellow citizens and at the same time save our health system hundreds of millions of dollars. I think that choice is pretty clear. It's a choice the Senate should take clearly on behalf of our students, of our future, and of our country. And with that, Madam President, I yield the floor.